So I'm Shane Devlin, Chief Executive of the Integrated Care Board for Gloucestershire and Bristol, North Somerset and South Gloucestershire. And what that is the Integrated Care Board is the organisation who has all the money and has for health and has to spend that money wisely to help our population to stay well and get better. So the presentation is about community, how we work as community to try to improve the health and well-being of people's lives. And therefore, it's about the health service and what the health service is doing, but actually people stay happy, healthy and well, not because of the health service, but because of so many other things in their lives. It's very much based on courage. How can we be brave to work together to break the cycle of a health service whose job is to fix people into a cycle where our job is to enable people to live happy, healthy, equitable lives. Very different. The health service for a long time has been a sickness service. How do you fix people when they are sick? And what we're trying to do now is actually it's about how do we collaborate to ensure that we drive population health and dramatically reduce health inequalities. So the key message, and it's across all of the presentation, is that people's health and well-being is completely influenced by the organizations around them and the people in those organizations. And the reality of people's health is that the health service is quite remote, but actually communities connect with the people in their communities. And therefore, how do we enable the fire service as a whole, but enable public service to work together to drive improvement at a community level? Because many communities are forgotten about when it comes to their health and well-being. And therefore, how do we create a culture where the responsibility for people's health and well-being is not that of the NHS, but of the providers, the communities, the organizations around the person in their community? I mean, it's fascinating. We've been going on quite a big journey in the NHS, because what we can clearly show is that the health outcomes for people, particularly communities racialized as black and brown, but people are getting inequitable outcomes for their health in their health service. And some of the positions we are uncovering are completely untenable. And therefore, we have to shift from a place where the health services job has been about equity of access, can everyone get the same thing, to a position of equity of outcome, which means we have to change some of the things we do to ensure many people get different and more. Because at the moment, the broad brush, single approach to healthcare does not drive closure in inequity. Quite the opposite. Those who can access our services, those who are economically active, as well as those with regards to racial discrimination, do not get the service that they need to drive equity. And that's what we're really trying to shift the system, so that actually what happens is we deliver equity of outcome, which means we need to invest disproportionately in certain communities so that they can get the outcome they deserve. So we're going on a journey very much so about really understanding dismantling systemic inequality. Okay? So our processes and our systems and the way we work need to be taken apart. Because what's happening at the moment is we've used the same systems, the same process, same way of working, and they outturn the same outcomes. And there has to be considerable reflection on really understanding the equity issues in the way we organize health and social care. And I can give you a really simple example. If you are a mother that is racialized as black or brown in our maternity services in health and care, you are considerably more likely to come to harm, potentially die in childbirth, than a white woman. That cannot be the case. That's simply, but it is true. And therefore, how do we reorganize our health and care system to understand why? And some of the why is about language, but some of the why is much more than that. It's about people trusting the health service, having access at the point they need, health literacy, understanding how the health service works. So they are situations that simply cannot be tolerated anymore, and the health service needs to step up and work out how it's going to change that. I think they are hugely important, and I think it's quite interesting. I get invited to speak at lots of conferences, and this one came across my desk, and I said, I'd really like to go and speak at that. And some of my team said, why? Because you don't work in the fire service, and you are not racialized as black or brown or Asian, so why? And I said, well, actually, if we are to be a health service that drives outcomes, I need to go and learn. I can certainly give, and I will happily give, but I need to learn. And that's why these are so important. You can have speakers on a stage who might say, here's the answer. But actually, part of my reason for being here is also just to understand, to speak to people and learn.